You should be able to see both myself and the screen now. Hopefully that is accurate. So I'm just going to start with this little kind of 20-minute presentation today. This is the Pelvic Acu Grand Rounds, and today we're going to be doing a little chat on Botox and overactive bladder. I'm Dr. Krystal Lynn Couture, the Pelvic Acu. I am both a physical therapist and an acupuncturist, and I specialize in teaching pelvic health to acupuncturists and weaving together the nature of the energy of the spirit, the physiology of the body, and of course, wrapping that into the traditional Chinese medicine patterns that we see exist through the energy systems of the body. So let's get into it. Okay, just in the chat. Okay, good. Some questions coming in. Okay, I'll pause on those for now. So just a disclaimer here. First off, I want to say, especially when it comes to like talking about Western medicine interventions, right? These slides are designed for educational purposes only. By sharing the slides, I hope to provide education to you guys as acupuncturists who are specializing in pelvic care, women's health, men's health, etc., right? Pregnancy, postpartum. But in no way am I suggesting support for or against the discussed educational content, right? So I'm not saying that I am a big supporter of Botox for overactive bladder, especially for every client, right? It's a case by case situation. But if we are specializing in these areas, we definitely need to know more. And the more that we understand, the more language that we can share that our clients understand and support what they're hearing from their physicians so that they can make informed decisions about those modalities, the better. So that's where I land there. And again, with anything that I'm sharing, if I'm sharing techniques or treatments or anything of that nature, if it resonates with you, take it in, make it your medicine, right? Make it a part of who you are as a practitioner, bring your unique energy to it, and spread it far and wide. That's the ripple effect. And if it doesn't resonate with you, then don't take it on, right? There's no 100% right or wrong way. Oh, Rebecca, hello. This presentation is for you. You were the inspiration. Right on. Glad you're here. Beautiful. So let's talk about overactive bladder first off. Okay. So 17% of women, the number is actually 16.6% of women are experiencing incontinence, and 3 to 11% of men are actually experiencing urinary incontinence. And this is marked by the urge to urinate that is difficult to control. It's also marked by the loss of urine as soon as the urge hits. So, kind of being unable to hold it, like immediately trickling urine or having full loss of bladder. It's also about frequent urination, which the standard is more than every 2 hours. So if we're urinating more than every 2 hours, that's considered frequency. Or if we're getting up more than twice in the evening at night when we're meant to be sleeping, that's considered urinary frequency. All of those sort of fit into this general category of overactive bladder. So there are really 4 theories of overactive bladder. And we're not going to go into these in great detail, but I do think it's important for us to take note of. So first off, the neurogenic theory, which is a reduction in the inhibitory neural impulses and an increase in the afferent impulses from the bladder that trigger the reflex to void. Then there's the myogenic theory, which essentially focuses on the detrusor muscle, which becomes more sensitive to cholinergic stimulation, leading to increased spontaneous activity of the bladder. And then, of course, we have the autonomous bladder theory, which is the alteration or exacerbation of phasic activity generated by the muscarinic stimulation. And then finally, there's the afferent signaling theory, which is spontaneous contractions of the bladder during filling, which result in an increased afferent output and hence the awareness, like over-awareness and oversensitivity of that bladder filling. So why so much attention on overactive bladder or OAB? Well, research shows, and there's a lot of research on this, that shows the symptoms associated with overactive bladder can significantly affect the social, psychological, occupational, domestic, physical, and sexual aspects of those who suffer from it. This is taken from the American Journal of Managed Care in 2000, but there are multitude of studies that indicate that overactive bladder negatively impacts quality of life. One more study from the Arab Journal of Urology in 2023 is that OAB is a prevalent condition in our population, and the associated symptoms negatively affect health-related quality of life, or HRQOL. Screening for overactive bladder should be considered during routine clinical visits using validated and reliable measures for early detection of symptoms and possible modification of risk factors to improve the outcome. And I think what's really important here is the acknowledgement of screening and the acknowledgement of objective measures. I love using objective measures like the Pelvic Floor Disability Index in my practice, because with that, I'm able to share with clients, right, the data from their self-report and then to chart progress. So I really, really like the idea of using objective measures as an acupuncturist, as a healthcare provider, to really get a baseline. Where is this client at? And then where are they going? Are our treatment methods working to help them make progress? So let's talk about overactive bladder prevalence and some correlations. A United States 2011 study estimates that 29.8 million adults aged greater than 40 years in the United States have bothersome overactive bladder symptoms. And the correlations that they found were older age, higher body mass, comorbidities, including heart-related issues, including diabetes, and then history as well of recurrent UTIs. And I love this study that it went into that history of UTIs, because I do see that clinically, that there is a huge, huge correlation between UTIs and then overactive bladder issues, and also other issues that are existing within the urinary tract system, right? So now, what is Botox for overactive bladder? Well, Botox has actually, believe it or not, been approved since January of 2013 for overactive bladder. It is generally done in a clinic setting under local anesthesia, most of the time by a urologist. Botox for overactive bladder wears off after about 6 to 12 months, and it actually averages 7.5 months of efficacy. The typical dosage is 100 to 200 units. So if you see clients that have, units of Botox into their face, very often the average is, once they're familiar with it, very often that average is somewhere between 40 and 70. So it's pretty high dose. So the expected benefits of Botox are a reduction or elimination of urinary incontinence, a reduction or elimination of severe urgency, a reduction in frequency of urination, a reduction in elimination of pad use for urinary incontinence, and of course, improved quality of life. So the potential side effects, there aren't that many, believe it or not. There's the biggest side effect concern is that there's an increase in post-void residual. And often this does resolve on its own, but in 4 to 6% of cases, according to two different studies that I looked at, self-catheterization is required with a 2 to 6 week duration. So that's not a pleasant outcome. And 4 to 6 isn't a high number, but it is a number worth considering. Other side effects include bleeding in the urine, or especially if they already have a predisposition, a urinary tract infection, which can occur with or without an elevated post-void residual. The other thing that people see, and this is common when they have Botox injections into the face as well, is flu-like symptoms. So those are the potential side effects that are researched. Western medicine did a really good job of sharing research about overactive bladder. and they actually did a durable efficacy study, which is a 3.5 year duration, which is pretty amazing because they're looking at the efficacy over time. So the results of this study, this 2016 study, were consistent mean reductions in urinary incontinence observed following continued Botox treatment. Durable improvements were seen in overactive bladder symptoms and in quality of life. A high proportion of patients rated their condition as improved to greatly improved, and the mean duration of the effect was 7.6 months. The most common adverse event charted in this 2016 study was UTI. And the rate of catheterization after the first treatment in this study was 4%. And that ranged from 0.6 to 1.7 after subsequent treatments. So it seemed to improve over time. The conclusions that they found were long-term Botox for the bladder consistently decreased overactive bladder symptoms and improved quality of life with no new safety signs or alerts. So you can kind of, before we move on, you can kind of take all of this in for what you will. Botox has a particular energy too, right? So that's important to consider. This durable study is people receiving Botox consistently at that 7.6 month mark, or whenever their Botox was wearing off between that 6 and 12 month window, right? So they're consistently receiving Botox. Now, what about further long-term effects? We're really not sure because those studies have not been done. 2013 is 12 years ago, but there's still more research, obviously, to be done. Now, the thing that I want to consider, right? We know that the way that Botox works with the face, the way that it works with the bladder, the way that it works within the body, right, is it has kind of this paralyzing effect, right? So that means that the reliance upon Botox in order for the body to function normally or effectively may be compromised, right? We may not be able to retrain the bladder with Botox. And these are questions I don't know the answer to. And I really don't know those long-term effects or when the stopping point is. When does Botox, injections over time become inhibitory, right? And is the quality of life result that these clients get worth it? I don't know. I can't choose for clients. I can only choose for myself, right? But there are, to be pretty clear, there are minimal side effects and there are good long-term results that do lead to improved quality of life, which is why I think that this has been an appealing and compelling treatment that urologists are offering. So now, well, what about acupuncture and overactive bladder? I looked at this 30 study meta-analysis, and it was really interesting because acupuncture had more favorable effects than sham acupuncture in reducing overactive bladder symptoms. Acupuncture improved overactive bladder symptoms as effectively as conventional drug therapy. However, the combination of acupuncture and drug therapy actually had more favorable effects than drug therapy alone. So that's another really interesting thing to consider. They were looking at 30 studies, so we're not going to go into the details of all of these studies, but this is overall what they found through that. So what's next for acupuncture? Where do we stand as acupuncturists? How can we be experts to support our clients with this concern when we're specializing in pelvic health? Well, acupuncture for overactive bladder certainly shows promise, and studies of better quality and consistency with bigger sample sizes are really, really necessary to help us to share this information with our clients, right? A study of 30 people is not enough to stand on a platform and say that acupuncture is, as effective as Botox, for instance. We also need more long-term durable efficacy studies. And we need studies that compare the effects of Botox to acupuncture. I think that would be really, really compelling. And I also think overall bladder function over time, when you combine that with a durable efficacy study, would be very, very interesting to see, because our work is used to really tonify, right? And used to help the body to heal itself, whereas Botox is doing quite the opposite of that. So here's some holistic recommendations that I have for clients that might be coming into your practice. For one, is, limiting the bladder irritants, right? Caffeine, alcohol, spicy foods, highly acidic foods, and artificial sweeteners are all proven by research to irritate the bladder and to cause increased frequency and even leakage. I actually had a male client who was in his 90s, and a really interesting client. And he started taking he went to the grocery store with his wife, and they're lovely, and he's like, oh, I see all the young kids drinking this Mountain Dew. I really want to try it. So he started drinking Mountain Dew, which has, of course, artificial sweeteners in it. It has caffeine in it, and it's got all sorts of dyes and other junk in it, right? And the wife, didn't really tell me about this until a while later. And she said at one point, his bladder symptoms are really getting worse, like overactive bladder, out of control, leakage, out of control. And I'm like, hey, what are we drinking? What are we eating? And I got this Mountain Dew story, right? And I'm like, okay, we have to stop the Mountain Dew immediately and see what happens. The symptoms improved by 70% within just that first week. And then he was back to baseline after 2 weeks by and baseline for, this 90-year-old male was, of course, much, much, further down than, a young person in their 20s, let's say. But alas, he returned to his baseline after 2 weeks. So these types of foods make big, big differences. I also recommend adding foods in to tonify the bladder. So apricots, apples, watercress, water chestnut, cabbage, bamboo, Swiss chard, whitefish, herring, sage, thyme, rosemary. You know what these are. These bladder foods. I have a cheat sheet that I give to clients, and it's like, these foods tonify the bladder. And I make sure that they don't interact with any of, the other things that we're going based on their TCM pattern, right? I also always recommend the pelvic breath to clients. That is a great way to get them tuned into the pelvic floor, to find out what's happening down there. With more awareness, with more neural pathways to that pelvic floor, we're going to start to support the energy that's there. We're going to start to understand on a client level what's happening. So it's really, really helpful. I also have most of my clients get a squatty potty. Getting in the proper position to void is so important. Another recommendation, of course, PTs do this a lot, and it's really about biofeedback, using biofeedback to understand what's happening within the internal muscles of the pelvic floor. And then, of course, pelvic strengthening, if that is in fact indicated, if we're not dealing with a tight pelvic floor. So some other recommendations, and these are kind of my holistic avoids. Avoid blowing the nose while urinating, right? It changes the pressure within the system in such a big way. And changing the pressure within the system when we're urinating is going to change the proprioceptive response, which really kind of messes with what we've got going on with the meridians, that ascending and descending energy of the spleen and stomach. We want to keep that aligned, right? Avoid urinating in the shower, avoid holding the urine for long duration, avoid urinating just in case, avoid power peeing. I don't know if you've seen this trend, but there is a trend that is out there that is power peeing, which is forcing the urine out. Males and females are doing this. This is not something that is going to be helpful to the majority of our clientele. And then also avoiding forceful excretion of the bowels. Squatty potty helps. I went through a bunch of studies, and I found points within those studies that have been proven to support overactive bladder. So here is my list of points: lung 5, stomach 40, CV9, bladder 28, bladder 53 or 48 if you're a 5-element acupuncturist, stomach 28, spleen 17, CV2, GV3, GV8. Now, of course, you have to make a decision based on your client, how they're presenting, what other patterns you're seeing in their body. But these are points that have come up that have been supportive for overactive bladder, and they're part of the list that I choose from when I am seeing overactive bladder clients. So far as the other technique that we have as acupuncturists is electroacupuncture, particularly posterior tibial nerve stimulation. So I've just given you kind of my treatment technique. I position the client in supine. I do one needle within the abductor hallucis, and the other, or the tibialis posterior, and the other needle adjacent to the tibial nerve, which is approximately kidney 7. And you're going to go fairly deep with that needle to get the appropriate stimulation. I'm going to use a biphasic waveform, frequency of 2 to 5 hertz, intensity. I want to see a contraction. So I want to see the great toe. I want to see it start to adjust. You'll also perhaps see a little bit of flexion of the other toes as well. And I usually say 20 minutes. Now, there are some really good research studies that are out there for MS clients, that are out there for let's see, uh, Parkinson's, there we go, Parkinson's clients, and they actually go to 30 minutes. Many of my MS clients and Parkinson's clients do not tolerate 20 or 30 minutes of stim to contraction. So I'll either go under the level of contraction or I'll do 5-minute series with them. One of my MS clients that I just worked with last week had a great result. And when she came back in for her next session, she was talking about whatever was going on in her world, which had nothing to do with her bladder. So at the end of her session, I'm like, hey, you know what? You never mentioned your bladder frequency because you went on a trip. Like, what was that like after, having the posterior tibial nerve stimulation? And she's like, oh my God, I totally forgot that I was even having issues with that. She's like, I didn't have any frequency at all. So I love when that happens. And posterior tibial nerve stimulation is a great, great tool that is in your toolkit. So, one literature review of techniques and efficacy of percutaneous tibial nerve stimulation suggested that PTNS results in short and long-term overactive bladder symptom improvement. It could be argued that the side effects with this treatment are more tolerable than those seen with the anti-muscarinics, which include dry mouth and constipation. In addition, there's concern for the non-degenerative cognitive impairment in the elderly with the chronic anticholinergic drug use. So basically, the studies were comparing the use of, remember we talked about those 4 theories of overactive bladder. The drugs that are out there that work with these essentially work on those theories, right? And so in comparing to the side effects and also for long-term use and short-term use, they see that posterior tibial nerve stimulation may have less side effects and be as effective in treating overactive bladder than drugs. So that's really, really exciting for us as acupuncturists. And there are a lot of research studies that are out there in regards to posterior tibial nerve stimulation. Some are with treatment on the surface and some are percutaneous. So we have that. Here are my references. I'll just take a sec. You can screenshot those if you like. One more page of references. There we go.